Thank you so much, Margie. And thanks to all of you for joining us to learn more about the latest local developments. We are fortunate to be equipped with safe and effective vaccines that serve as our best pathway forward and out of this pandemic. Vaccination has been a game changer and a lifesaver. However, with many in our community still unvaccinated, whether because they are not yet eligible or because they are hesitant, the Delta variant continues to impact our community. And those who are experiencing some of the most severe outcomes are those who are unvaccinated. And this is part of why ensuring people who are unvaccinated have easy, efficient, and convenient access to vaccine remains a top priority for the Lincoln-Lancaster County Health Department. Over 73% of our residents locally, age 16 and older, have already rolled up their sleeves to protect themselves and their loved ones in our community, and we strongly urge everyone else to join them and get vaccinated. Because of recent progress made by scientific experts helping us understand the virus and how it works, certain groups of people now are able to extend and enhance their existing protection against COVID-19 and its variants through a booster dose. Pfizer booster doses were approved by the Centers for Disease Control and Prevention on Friday for specific populations, including those 65 years and older. Efforts are already underway in our community to provide booster doses to residents who are eligible. Several local pharmacies started offering boosters this weekend, and the Lincoln-Lancaster County Health Department will hold its first booster clinic tomorrow. And while vaccination remains the best tool in stopping the spread of COVID-19, our local Delta variant-driven surge has necessitated that we use other proven public health practices, like masking, to help protect our community and ease the strain on our hospitals. Some of our numbers are heading in the right direction, but not all. The choices we make today can directly influence the number of cases and hospitalizations we'll see in the weeks to come. It's critical that we stay focused on the here and now and on the actions we need to take to make continued progress on our pathway out of the pandemic. Health Director Pat Lopez will now give us the latest data on our local situation.
Thank you, Mayor. Since last week, we have seen an improvement in our case numbers, but the positivity rate is still high, and the number of COVID-19 hospitalizations remains high as well. The 7-day rolling average of new cases shows a decline from a high of 140 on August 30th down to 90 toward the end of last week. This is very encouraging, but we need to see a more sustained decline in new daily cases. A COVID-19 outbreak at Lancaster County Corrections has resulted in 73 new cases. We have been working closely with the corrections officials to implement measures to contain the outbreak. And over the past few weeks, the positivity rate has flattened and hovered around 10%, but this is also too high, and we want to see consistency with the positivity rate well below that 10% mark. As I mentioned, the number of COVID-19 patients hospitalized locally remains high, and hospital capacity continues to be seriously strained. When we look at the 7-day rolling average of COVID-19 patients in Lincoln hospitals, you can see that we still have a high number of patients, but hospitalizations have leveled off this past week with an average of 100 patients daily. Unfortunately, we are reporting another increase today with 112 COVID-19 patients in local hospitals and 20 on ventilators. The breakdown is about 50-50, with 56 patients coming from Lancaster County. Last week, we talked about the number of Lancaster County patients declining and the number from outside the county increasing. This shift continues with the number of Lancaster County residents hospitalized dropping from a high of 74 on September 3rd to 56 as of today. The number of patients from other communities has increased from 31 on September 3rd to 56 today. And sadly, we report 3 more deaths today. A female and a male, both in their 70s, and a female in her 50s. 2 of these individuals were not vaccinated. A total of 17 deaths have been reported so far in September, and 27 were reported in August. As I said earlier, some of our indicators are showing improvement. That includes the number of new daily cases, the turnaround rate for lab reporting, and the speed of contact tracing. Unfortunately, other indicators have remained at high with little change. Our positivity rates in the red and 2 metrics are in orange, hospitalizations and COVID-19. After analyzing all these metrics, the risk dial is moving down from mid-orange, where it has been for 5 weeks, down to low orange. The current position of the dial is indicated by the blue square outlined in red on the chart. This is a move in the right direction. However, orange indicates that the risk of the virus spreading and the impact on our community continues to be high. Throughout the pandemic, we have taken thoughtful, measured steps based on data to slow the spread of the virus, to prevent illness and save lives. This strategy, along with the actions we've taken together as a community, has served us well. The improvements in some indicators that we've seen since restoring the indoor mask mandate is encouraging, but case counts and our positivity rate are still high. Hospitalizations continue to cause serious strain on our healthcare system. The data tells us that our situation is still critical and our community is not yet in a position where we can safely end the indoor mask requirement. We must exercise caution and not remove measures too soon, only to have numbers quickly reverse and start heading in the wrong direction once again. We will be extending the directed health measure through October 28th at 11:59 p.m. and it will be posted at covid19.lincoln.ne.gov. I know this is not the news we were hoping for, but it's important to understand that extending the mask requirement is a necessary step to help us get through this surge and back to where we want to be. Masks have been proven effective in preventing the spread of COVID-19. In joining us today is Dr. Eric Avery, President of Lancaster County Medical Society. He will share some important information from the medical community. Dr. Avery.
Thank you, Director Lopez, and thanks for having me again today. This continues to be really difficult, and the medical community still really appreciates everybody's help in wearing masks and doing the right thing and taking care of each other and protecting each other. Unfortunately, as we've talked about many times before, when somebody gets sick with this virus, their symptoms don't always resolve right away. Lots of people have problems that last for days, weeks, and even months. And so when we're talking about the number of patients that are in the hospital and continuing to be in the hospital and the really high numbers in the hospital, unfortunately, this is a slow process for a lot of people to get over. Ultimately, we truly support the mask mandate. I know it continues to be something that we want to get rid of, and everybody is tired of all of this, and it will get better as we continue to work together, as people continue to get vaccinated, as we continue to work together to protect each other. I just received a message from the hospital today that they had 23 patients sitting in the emergency room because they didn't have a bed to put them in. That's 2 out of 3 of the hospitals that couldn't even take a patient from the floor up to a room because there just isn't any room in there. We know that wearing masks is proven to be effective in preventing some of the transmission. And then when you add that in combination with with vaccinations, the risk of severe disease is significantly lower. But we still have to protect people who are still vulnerable just because their immune system hasn't been able to make the appropriate antibodies. And even as important is, there's a lot of people that still aren't eligible to get the vaccine yet. So as we continue to protect one another, we need to continue to wear our masks. We need to continue to encourage good dialogue, not judgmental dialogue about getting vaccinated. If you have any questions, talk to your doctor, don't talk to Facebook and Twitter and TikTok to try to find out the latest, greatest gossip. Talk to your doctor and find out if the vaccine is right for you, if they have any concerns, or if there's anything else that they want you to know about. And then flu season, it's time for your flu shots. Wear your seatbelt, take care of your diabetes and high blood pressure, eat right, exercise, and do all those things that we always want people to do. So stay safe and healthy. Thank you.
Thank you, Dr. Avery. We really value the continued support and assistance from the Medical Society and from our many physicians in the community. Also joining us today is Dr. Steve Joel, Superintendent of Lincoln Public Schools, to share an update on some of their pandemic response efforts. Dr. Joel?
Thank you, Director Lopez. Appreciate this opportunity very much. Mayor, appreciate your leadership as always. I think that as a community and certainly from a school district perspective, we're making progress, but we still have a ways to go. And we so appreciate the working relationship with the team at the Lincoln Lancaster Health Department. We continue to meet on a regular basis. Well, we know that our protocols are working. We know that our students that are masking up and our staff that are masking up have led to the prevention of large numbers of students from getting sick and from having to quarantine if they are near a COVID positive person. And we see that in our school district data. Since the DHM on face coverings went into effect on August 26th, we've seen a steady decline in our internal numbers. Now that is really important for us because, as we have learned, we need our students in school. Our students in school are doing well. Our staff want them there. Our parents want them there. Our business community wants our parents to have their students in school. And so it's incumbent on all of us to do what we can to keep our students in school because of that in-person experience. And to further articulate that, we just received recently in the last few days our first swipe at analyzing our student achievement data from last year. And what it points out very, very clearly is that students in school did better than students that were not in school. So whatever we need to do to partner with the City of Lincoln and the Health Department and to keep our kids safe and our students safe, we want to be able to do it because we know that that's how our students can have a successful academic year. And we're going to get them ready for graduation as they get ready to enter college, the military, careers, whatever their vocational choice is. But we also know that, and we hear this quite regularly from our parents, when schools close or a student is not able to come to school because of being in close contact and or in quarantine, then families are forced to stay home with their students. And that has an impact on our business community. Just another reason why it's so important that we continue to do what we're doing. And we appreciate very much Director Lopez and the Lincoln Lancaster Health Department for being on the front end of this. And while everybody wishes that we would not have restrictions or we wouldn't have mitigation measures that we have to do, I can tell you from the Lincoln Public Schools perspective, we understand what our role is, and we want to keep people out of the hospital. We want to keep our teachers in front of our kids, and we want to keep our kids in our classrooms. So we're going to continue to monitor, and we're going to work closely with the Lincoln Lancaster Health Department. And as many have said, we encourage everybody to get a vaccine if they're eligible to get a vaccine. And we're looking forward to the expansion of vaccine accessibility to our younger students as we go forward. And it looks like there's some developments positively that are occurring there. And then, I'll say, as I've always said at every one of these press conferences, we are a big partner as a school system, or as a large partner with the community of Lincoln. We want to do our part, and I think that we've got a proven success record right now. Let's continue the work, and let's make it a community-wide effort, and let's get masks off kids and teachers, and let's get back to normal as quickly as we can. So, very much appreciate the opportunity to be here. Thank you both for your excellent community leadership.
Thank you, Dr. Joel. And as always, we appreciate the work that Lincoln Public Schools is doing to protect the health and safety of our students and staff, which in turn helps protects our entire community. We meet every week with the administrators from the schools in Lincoln and Lancaster County, both the private schools and the county schools, as I mentioned, and they all are doing a tremendous job to keep students in school, in the classroom, and to keep teachers there, so that all those things can be accomplished that Dr. Joel is talking about, and that's been our goal, and it's really critical for our community. We're looking forward to hosting some upcoming clinics at several middle and high schools in the coming weeks. We continue to work with the schools, colleges, and universities to bring vaccination opportunities on site for students and staff. Just hours ago, Pfizer announced that it had submitted COVID-19 vaccine data on children 5 to 11 years old to the U.S. Food and Drug Administration for initial review. A formal request seeking emergency use authorization is expected to follow in the coming weeks, according to a statement released by the company. While this isn't a firm timeline as to when vaccine may be available for this age group, our health team continues to work with local partners on plans to provide vaccine to children in this age group as soon as it's available. Our goal is to get these children protected as quickly as possible. As the mayor mentioned, booster doses were approved last week, and we immediately put our plans into action so we could start a booster dose clinic through this week. A booster dose helps maximize the existing protection a person already has against COVID-19. Right now, the booster dose recommendation only applies to people who have received 2 doses of Pfizer vaccine, and the booster dose will be given to individuals at least 6 months after that second dose of Pfizer vaccine. Certain groups are now eligible to receive the booster, including people 65 and older, residents in long-term care facilities, people 18 to 64 with underlying medical conditions that put them at high risk of severe outcomes from COVID-19, and people who work or live in a setting where they have increased exposure to COVID-19. The health department will be providing booster doses by appointment only through designated booster clinics. We're using an approach similar to the initial rollout of the COVID-19 vaccine, moving through the age and priority groups and stages. We're starting with clinics for older adults 75 years and old and up. We began contacting people yesterday, and more than 1,000 are now scheduled to receive a booster dose. Our first clinic is tomorrow. It's one of 3 clinics we're having this week in partnership with CHI St. Elizabeth's. We will share more details on future clinics very soon. Again, the booster shots are only for those who receive Pfizer vaccine. Potential booster recommendations for Moderna and Johnson & Johnson vaccines are still being determined. We are monitoring new developments closely and will provide more information as soon as it becomes available. Several local pharmacies are also providing Pfizer booster doses. You can find a pharmacy near you at vaccines.gov or by texting your zip code to 438829. Offering vaccination to those who haven't yet received it remains a priority, and we continue to work with community partners to host clinics that are accessible, convenient, and close to home. Every person vaccinated provides needed protection for our community, and we strongly urge everyone who is eligible to get vaccinated. The time is now. Lancaster County continues to lead the state with the highest vaccination rate. As the mayor said, more than 73% of Lancaster County residents aged 16 and older are fully vaccinated. Remember that 73% rate is just for those 16 and up. When we look at vaccination data for all 319,000 Lancaster County residents, 59% are fully vaccinated. Some of those who are still unvaccinated are not yet eligible, but our data shows that there is still around 21% of our population, or close to 67,000 people, who are eligible for vaccine but have not yet received it. Vaccination continues to offer strong protection against severe illness, hospitalization, and death, as Dr. Avery mentioned. If you have questions about the vaccine, we urge you to get answers from your healthcare providers or another trusted and credible source. Even if you've had COVID-19, research shows that vaccination can offer additional protection against reinfection. Getting vaccinated and wearing a mask, these are proven public health prevention strategies that help protect our community and will get us through this surge. And we still need to use them for the time being. Our efforts are making a positive impact, and we need to keep them up until we can achieve a sustained decline in our cases, hospitalization, and positivity rate. Our actions have been and will continue to be guided by the latest data. Once again, you can find information on the directed health measure along with frequently asked questions at covid19.lincoln.ne.gov. And residents can track our local data via the COVID-19 dashboard. We also issue COVID-19 updates every weekday that include the latest data and information. These are all posted at the covid19.lincoln.ne.gov site. You just click on COVID-19 News Release button on the top left side. You can also find the updates on the city's homepage at lincoln.ne.gov in the latest news section. And if you use social media, you can follow the City of Lincoln and Lincoln-Lancaster County Health Department on Twitter and Facebook for COVID-19 information and updates. If you have a COVID-19 question or you're seeking general information resources, the hotline is operational Monday through Friday from 8 to 4:30 at 402-441-8006. And with that, we'd be happy to take any questions.
Hi, Pat. It's Ben Olding with the Journal Star. Hi. I wanted to ask you, this is a question that I've been getting from people, is why do we need to continue to have a mask mandate in Lancaster County when similar counties like Douglas and Sarpy, metro counties, have lower rates of COVID-19 cases on a per capita basis than we do here, and they don't have mask mandates?
Well, I don't think it's really accurate to say they don't have mask mandates, for one thing. OPS in Omaha and Westside are just two of the largest school districts that do have mask mandates in place, as long as some of the schools in Sarpy County. And the other thing that all data isn't comparable by just looking at a number. We've been talking with Douglas County and Sarpy County, and the other thing that you'll see is there's a lot more testing going on in Lincoln than there are in those communities. So if you're not testing, you don't have cases. And so those are two of the biggest factors that we're seeing here. We're doing a lot of testing and doing early identification of cases.